Check this out. If my doctor has included in my record I have headaches as a result from medication or just headaches in general, is that good enough for a diagnosis? Trying to get 50% for headaches because they are prostrating for hours almost daily. So to answer your question, is this going to be good enough? You're not going to find out if it's good enough until after you get your decision letter in 5 months or a year from now, or however long it takes those assholes to adjudicate your claim. Do you really want to find out if it's good enough? I mean, yes, they still can screw everything up. But if you're doing your research, you guys are on the internet, right? So you're asking questions, you're looking around like, oh, will this be sufficient for a diagnosis? This looks a little nexus-ish. Not a word, this kind of looks like symptoms. No, diagnosis, symptoms, nexus. You don't want to wait 5 or 6 months and then get denied. Fuck, this sucks. I kind of knew it. I knew it, man. I knew I was going to get denied. And then you have to go back and file a supplemental claim and then get medical evidence to submit in the appeals process. Now you're at 18 months. You could have just did this up front. Either way, you're going to need the medical evidence. Get it up front. This one, service connection for headaches. You were previously denied service connection because while your service treatment records reflects complaints, treatment, or a diagnosis similar to that claimed. Okay, let's look at that. It's a diagnosis. You need a current diagnosis. Reflects complaints, treatment, or a diagnosis similar. None of that shit's a diagnosis. So there's one thing. Read these decision letters that are in forums and stuff like that. You can get a lot out of reading from these things. We did not find a link between your medical condition and military service. The nexus is the link. We didn't find the link. We didn't put any effort into looking for it, but we still didn't find it anyway. You're fucked. Without evidence establishing a link between a headache condition and your military service, your claim remains denied. It will continue to remain denied. It's going to stay denied until you actually come up and give them the nexus link or give them an actual diagnosis. Symptoms are a little bit different because once you establish service connection, you have a rating. It may be 0% rating, but you don't have to worry about the diagnosis or the nexus anymore. Now you need to get these symptoms properly documented. Here's a list of going to the doctor. There's a scar. There's follow-up injections. There's severe lower back pain. There's some cramping and some other shit. It'll say diagnosis. Do you see a diagnostic code? No, this is just a list of doctor's visits, and this is not a clear diagnosis with a diagnostic code. This is just a problem list of sorts. Here's one for service connection for a neck condition. Your service treatment records do not contain complaints, treatment, or diagnosis for this condition. The evidence does not show an event, disease, or injury in service. It calls for a current diagnosis. So really, they don't even need to say contain complaints or treatment because they're irrelevant. What's relevant is the diagnosis, but your service treatment records don't have any of this shit. So kick rocks, veteran. Here's another one. This is in the My Healthy Vet stuff, the Blue Button Report. The famous SCT codes. Damn, this is looking pretty legit. This looks like it might be a diagnosis. Technically, this is a finding, meaning a clinically significant observation, but it's not a diagnosis. It's an SCT code. The VA uses a system called Systematic Nomenclature of Medicine for identification of patient problems. This, again, is not a diagnosis. None of these things are a diagnosis. You need a diagnosis, a current diagnosis. So none of these things are a diagnosis, so you need to find one. This is a diagnosis. Does the veteran have a diagnosis of PTSD that conforms to DSM-5 criteria? Yes. ICD code F43.10. Check. Yes. Going down the page. Mental disorder diagnosis number 1. PTSD. ICD code and there's comments. This is a diagnosis, and this is exactly what you need to submit when you file your claim. You file this up front when you submit your claim, and then you have it. You have your diagnosis. You have your symptoms. You have your nexus. In this case, this is just covering the diagnosis part. You get medical evidence to support your disability from a doctor. Your evidence is going to be challenged at your C&P exam by another medical professional. They might be a real doctor, or a nurse, or a PA, or a chiropractor, or they might just be some other asshole. You don't know what you're going up against, so you want to get a real doctor to write a real opinion and diagnosis, symptoms, all that stuff for you, because you might be going up against another real doctor. It matters. The C&P examiner is hired by the VA to deny your claim. You're not paying for your C&P exam. The VA is paying for your C&P exam. They are getting paid to deny your claim. They're not on your side. You want a real doctor to go up against another real doctor. If your evidence comes from a nurse or a chiropractor and your C&P examiner is an actual real doctor, then your evidence will have less probative value. Now we're going to go into probative value because it matters and it's important. Probative value refers to the reliability and weight to be attached to the evidence concerned. That is your evidence. If you show up with none, you don't really have much reliability. It's all on the C&P examiner that's hired by the VA. If the evidence that you show up with is from a nurse or somebody that's lesser qualified than a doctor, then it's going to carry less weight. So you show up with your nurse medical evidence and you go up against a C&P examiner, he's a doctor. This guy's going to have more probative value every day of the week, all day long. That's just the way it is. Here's a snippet out of the M21-1 adjudication manual that covers the principles of reviewing and weighing evidence. This is what the VA raters do. They want to determine the probative value. They want to see if it's relevant. They're going to weigh the evidence and see how much probative value your evidence has. So if your evidence has none, they're not going to give you much. All right, I got it. Good enough isn't good enough. I need to win. What do I need to do? How do I do this right? You hire a real doctor yourself that's on your side that you pay for. That's how you do this. You don't rely on the C&P examiner that's a hired gun by the VA. How to hire a real doctor? You can work with our partner. Send an email to medicalexperts@secondstrata.com and include your phone number in your email and tell them what you need. You're going to get a consultation over the internet, video teleconferencing. VA does it all the time. I'm sure you guys are familiar with Zoom and all that kind of stuff. And it's going to be a face-to-face between you and a doctor. And they're going to look at you. I mean, they're board certified. They have rules in their states. They're not going to just diagnose you with whatever the fuck you want to be diagnosed with. They're going to diagnose you with a disability. They're just not going to fight you, and you're paying them. So that's the difference. Other ways to do this are go to your private doctor or go find a doctor that lives close to you that'll do this. But the easiest way to do this is just contact Second Strata, send them an email, set up an appointment, tell them what you want to do, and then get face-to-face with a doctor. And then you're going to walk away and you're going to have that diagnosis. You're going to have your symptoms and you're going to have your nexus clearly documented. It won't be ambiguous. And you submit that when you file your claim. I'm not saying the VA is not going to fuck the whole thing up because that's what they do all day long and they're the enemy. But at least you're grounded in good, solid medical evidence and legalities. Legalese. It's legal. I'll see you in the next video.